Hey everyone, my name is Dr. Jocelyn Conley, pelvic floor physical therapist, and in this video, I'm gonna go over one of the single leg hip hinge variations. In the previous videos, I talked about the Romanian deadlift or the single leg hip hinge, and then talked about ways to enhance it, regress it, common errors, and then the second video, I showed a couple variations that were different from the first one, and then this one, we're gonna go over the last variation. So the purpose of this variation is to work the side glutes and the glute max, hamstrings on one side when the pelvis is more, not in a pathologic standpoint, but lax. So there's less tension going across the pelvis, so it loads the muscles on the leg that you're standing on more. And that is really important for just general walking, for changing directions when we're walking, running, and doing different things in the gym and sport. If you cannot do this because of balance, you can do this holding on to something like a stick or a wall. No problem with that. And I'm just gonna go over the main basics here. You're standing, starting in a neutral spine, tip from your hip, chest comes forward, your pelvis and your hips, pelvis, and shoulders stay in neutral, then you come back up. Notice that this leg is just hanging by the side, and you come back up. Tip, and then come back up. As you tip forward, you want to make sure this doesn't happen. Your hip and knee are in line with the middle of your foot. Your back stays in neutral and your torso doesn't beat, your upper torso doesn't beat your lower torso. Everything stays connected. As you tip from your hip, shin stays vertical with the ground. If you can keep your legs more straight, that's fine. Otherwise, soften it and just let it do what it wants. And you want to feel a stretch in the back of your leg. Then you're going to meet that stretch by squeezing your glutes and essentially pulling the ground from underneath you to come back to neutral. And you're controlling that position the whole time. Common errors is when you're tipping, you're like opening up or not opening up, going the opposite. The other common error is that it's like a lunge, like people's knee and hip are moving, whereas we want the hip to be moving. Other error that I've been kind of referencing is that people are not starting in neutral, or their upper torso is lowering much more than the rest of their torso. So you gotta keep your ribs and your pelvis stacked the whole time. Ways to breathe: inhale as you tip, exhale as you come back up. Keeping your chin tucked will help maintain a neutral position. If you're up here, your neck stabilizers are probably working harder than lower, so keep your neck in neutral. Try it, guys. I swear it does make a difference. And then how to train this. I've mentioned before that, this is a regression because you're not having to focus on keeping your hip in extension. But it's also not a regression because it's just a different exercise. I like to use this to really train side glutes for fast movements or turning. And then, of course, who doesn't want good side glutes from an aesthetic standpoint? But that's just a benefit for feeling good in your hip. A lot of people don't have this development. They have the flat bum. Or they're just missing this piece. This is something that I'll load with 2 weights or 1 weight. 2 weights, I'm really working on strength. 1 weight, I'm working on strength and balance. And I'm talking core, because if I'm holding a weight on one side, then it's gonna wanna pull my torso. So that's one way to train it. I can do this. If I'm working on strength, time under tension is key. So 3, 2, 1, pause. 3, 2, 1, pause. So 3 counts down, 3 counts up or 2 counts down, 2 counts up. Sometimes I'll drop quick and then come up slow. That trains something a little bit different, like speed and power that you'll see with Olympic weightlifting or with sports. So many different options. And that's why it's super important to work with someone if you're not sure what is best for you. If you have any questions, please comment below. Again, my name is Dr. Jocelyn Conley. If you like this video, please press the like button and don't forget to subscribe so you're notified every time a video is dropped.